So hi, my group will be presenting about necrosis. So the presenters are myself, Kashmeeta. Then we have Eshika, we have Renisha, we have Darshni, and we also have Kausalya. Necrosis. What is necrosis? The focal death along with degradation of tissue by hydrolytic enzyme liberated by cells. So there are many causes of necrosis. The first one is due to the loss of blood supply. The second one is bacterial toxins. The third one is physical irritants and chemical irritants. So for the loss of blood supply, it is due to the blockage of blood vessels or blood clot, which is immediated local anoxia. Second one is bacterial toxin, which is the inflammation produced, and if it's strong, the result is necrosis. Physical irritants are, for example, heat, excessive cold trauma, and radiation, whereas for chemical irritants is strong acid. There are two changes characterize irreversible injury in necrosis. The first one is cell digestion by lytic enzyme, and the second one is denaturation of protein. Cell digestion by lytic enzymes, identified as homogeneous and intensely eosinophilic cytoplasm, may show cytoplasmic vacuolation and dystrophic calcification. Denaturation of protein, seen as characteristic nuclear changes in necrotic cells. There are three types: pyconosis, carlolysis, and choriorexis. There are approximately 6 types of necrosis. The first one is coagulative necrosis. Second one is liquefaction necrosis. Third one is gangrene necrosis. Fourth is cautious necrosis. Fifth is fat necrosis. And the last but not least, which is the sixth, is fibrinoid necrosis.
My name is Renisha, and I'm going to start off my presentation by presenting about liquefaction necrosis. Now, what is liquefaction necrosis? Liquefaction necrosis is dead tissues that turns into viscous mass, which is liquid, whereby necrotic tissue softens. The gross appearance of liquefaction necrosis are liquid form and sometimes seen as creamy yellow color due to pus formation. Microscopic appearance of liquefaction necrosis are inflamed cells with numerous neutrophils. Liquefaction necrosis usually affects central nervous system, which includes the brain, spinal cord, and nerves. And it usually affects especially the brain due to high lysosome enzyme concentration. So when the brain cell dies, lysosome enzyme digest them, causing liquefaction of tissue. This leads to formation of cysts with pus-like fluid, which gives it the liquid form. Liquefaction necrosis is caused due to infectious agents that infects and damages the cell, causing inflammation. Infectious agents are bacteria, fungi, and viruses. Obstruction or blockages of blood flow to central nervous system would also cause cell to die and lead to liquefactive necrosis. This is an example of microscopic appearance of liquefactive necrosis brain. The symptoms exhibited when you have liquefaction necrosis are changes in mental status, decrease in movement, fever, loss of coordination, and seizure. Liquefaction necrosis is diagnosed by a CT scan, MRI scan, blood culture, and complete blood count. Needle biopsy is also used to identify cause of infection. The treatments available currently are antibiotics for bacterial infection, antifungal medication, surgical removal of necrotic tissue, or complete amputation of affected limb. Gangrene necrosis is divided into two categories, which are dry gangrenous necrosis and wet gangrenous necrosis. Dry gangrenous necrosis leads to coagulative necrosis, which usually occurs in people with diabetes or atherosclerosis that damages blood vessels and affects blood flow. So skin becomes dark, dry, and shriveled, and it spreads slower than wet gangrene. Wet gangrenous necrosis leads to liquefactive necrosis when exposed to bacteria. It can also be developed from dry gangrene if it's infected. This often happens in diabetic people that injure themselves and due to severe burns and frostbites, causing skin to swell and pus to form from infection. The gross appearance of gangrene necrosis is black skin with degrees of putrefaction, which means decay, whereas the microscopic appearance of gangrene necrosis is combination of coagulative and liquefactive necrosis due to wet and dry gangrene. Gangrenous necrosis usually occurs at arms, fingers, legs, toes, and muscles due to loss of blood flow, which happens due to lack of oxygen and therefore leading to death of tissues. Gunshot wounds or even crushing injuries from car crash also leads to open wounds that allows bacteria in, causing gangrene necrosis when left untreated. The symptoms of gangrene necrosis are skin discoloration, swelling, blisters, severe pain, and numbness. If it spreads throughout the body, it also causes low blood pressure, shortness of breath, and confusion. The diagnosis done for gangrene necrosis are via physical examination, X-ray, MRI, and CT scan, and blood tests. The treatments available are medications, amputation of infected part, or removal of infected tissue. The most popular treatment for gangrene necrosis is known as hyperbaric oxygen therapy. It is performed in a pressurized chamber with pure oxygen to help blood carry more oxygen and to slow the growth of bacteria in infected tissues. This helps them heal. It lasts for 90 minutes and must be done for at least 2 to 3 times daily. The side effects are pressure in ears or nose and temporary nearsightedness. Thank you.
I'm Eshika, and I'll be presenting about caseous necrosis. Caseous necrosis is a hypersensitive reaction that is due to infection with Mycobacterium tuberculosis. For the microscopic appearance, it is found in the foci of the tuberculosis infection, and it appears structureless. It involves the formation of structure called granuloma. It has the combination of both coagulation and also liquefactive features. The lymphocytes and activated macrophages like giant cells and also epithelioid cells were observed to be surrounded in the necrotic area. This is the microscopic view, and you can see this is the necrotic area, the giant cells, the epithelioid macrophages, and also the lymphocytes. For the gross appearance, it appears soft, granular, and also yellowish. It has the cheese-like look, and the symptoms are constant coughing, coughing up blood, fever, chills, and also loss of appetite. For the diagnosis, PET-CT scan. Treatments, antibiotics, and prevention, staying at home or covering cough. Thank you.
I'm Darshni, and I'm going to continue talking about fat necrosis. What is fat necrosis? Fat necrosis is a condition that happens when a person experiences an injury to an area of fatty tissue. This results in the fat being replaced with the original oily contents of fat cells. Fat necrosis appears like a small hard tumors. It is a non-cancerous tissue and mostly occurs in areas with fatty tissues, and most commonly in the breast. So now let's look on what's the cause of fat necrosis. Fat necrosis is usually caused by physical trauma, history of radiation to a particular area of tissue, or history of surgery to a particular area, or history of removal of breast implants. It is also caused in women who are obese and have large breasts. Now, how this fat necrosis is being diagnosed? If there are presence of lumps, the doctor might recommend you to perform a breast exam, mammogram, or ultrasound to identify whether the lump is fat necrosis or tumor. The symptoms of fat necrosis are lumps with a red area around them, lumps that can appear bruised around them, or skin around the lump that appears thicker than affected area, the nipple retraction due to fat necrosis in the breast. Next, we look onto the pathogenesis of fat necrosis. Fat necrosis is free from contaminants such as bacteria or viruses. The saponification takes place. This is the process of fat converting to soap through the use of heat. Lipase is the enzyme used to conduct this conversion. It forms a complex with calcium to form this process. Now let's look on how to prevent fat necrosis. Fat necrosis can be prevented by keeping a track of winning fat by going for a yearly mammogram to observe whether there is any formation of lumps. Fat necrosis can be treated by massaging the infected area firmly to resolve some of the firmness. A needle aspiration might be recommended by the healthcare professionals. This procedure is done by inserting a thin hollow needle into the area of fat necrosis to drain the oily contents. This will usually cause the lump to disappear. Apart from this method, surgical removal only will be recommended by the healthcare professionals if the lump is larger or difficult to access with the needle aspiration procedure. Next, we'll look onto the complications of fat necrosis. The areas of fat necrosis in the breast do not increase a woman's risk of breast cancer. Fat necrosis areas in the breast can closely resemble breast cancer tumors since it causes changes to the breast that are similar to cancer-related inflammation. The appearance of fat necrosis can be very frightening for some women because they are quite unfamiliar with the fat necrosis. The average age of a woman who might experience fat necrosis is at 50 years. Fibrinoid necrosis. What is fibrinoid necrosis? Fibrinoid necrosis is a form of cellular death that results in the formation of fibrous tissue which occurs in the blood vessels throughout the body. This fibrinoid necrosis can be recognized only in histological preparation and has no distinct microscopic features. This image shows the microscopic image of fibrinoid necrosis. When stained with hematoxylin and EOC, this will appear brightly eosinophilic and smudged. What are the causes of fibrinoid necrosis? Fibrinoid necrosis can be caused by high blood pressure that damages the cells in the blood vessels, which leads to cell death. It is also caused by preeclampsia, vasculitis, infection due to the rejection of an organ transplant. The symptoms of fibrinoid necrosis are nose bleeding, bleeding gums, blood in the urine, blood in the stool, muscle bruises, hemorrhage of spleen, and other organs. However, for the treatment of fibrinoid necrosis, there are no specific treatment for fibrinoid necrosis till now, but it can be treated by treating the cause of fibrinoid necrosis. For example, if you have high blood pressure, which is related to fibrinoid necrosis, then it can be treated by giving medication to lower your blood pressure. So that's all from me. Thank you.
Hi, my name is Kausalya Devi. I'll be talking about coagulative necrosis. Coagulative necrosis is the most common type of necrosis. It is caused by irreversible focal injury, which is mostly because of ischemia. This is less often bacterial and chemical agents. The organs commonly affected are heart, kidney, and spleen as well. Grossly, early stage the skin will be pale, firm, and slightly swollen. At the progression stage, there will be yellow, swelling, softer, and shrunken as well. For this thing, cytoplasmic and nuclear details are lost. Cells are swollen and appear more eosinophilic. Cell digestion and leukofaction fail to occur. Eventually, the necrosed tissue infiltrate by the inflammatory cells and the dead cells are phagocytosed, leaving granular debris and fragments of the cells. There are some fun facts about this necrosis. So if you want to understand necrosis, understand and memorize it more, we can use this fun facts thing. Fun-filled life can get complicated, which means fun is equals to fat necrosis, filled fibroid, life is liquefactive, can is coagulative, get is gangrenous, and complicated is caseous. As for the median survival of a person with necrosis is around 10 years, and the only cell that survive from necrosis are in our eyes, which is very safe. Coagulative necrosis is the most common among people all this while, and the gangrene necrosis commonly occurs in diabetic patients due to the lack of blood supplies to the body.